Microphone is your normal.
Good evening, dear participants. Glad to be here with you all once again today on the session on behavior and management and emotional regulation. Allow me a minute, I'll just reshare my screen. I'm requesting the participants to kindly put in the chat box your name and the location you're from. Just put your name and the location in the chat box, please. I hope you all can see the screen.
Yes, doctor.
Thank you. All right, so format is the same for this webinar. Initially, first 35, 40 minutes, I will just give my presentation, and post presentation, we will have question and answer sessions. So you may keep all your questions ready and we will have a discussion. So behavior management and emotional regulation in autism. Today, we are going to talk about these two very important topics, behavior and emotional regulation. Understanding, preventing, and supporting, and from perspective of children and adults both. So once again, welcome everyone. Today we'll be talking about behavior management and emotional regulation in autism, focusing on both children and adults. The session is meant to help us understand why behaviors happen and how we can support regulation in practical, respectful, and effective ways. The goal is not to control behavior, but to build skills and emotional safety. So what is behavior? In autism, when we talk about behavior, in very simple terms, behavior is nothing but communication. The person with autism, the child or adult, is trying to communicate to you through their behavior. They often express with behavior their unmet needs, sensory overload, emotional overwhelm, and difficulty with communication. So the behaviors which we generally see in children or adults with autism, uh, we try to manage those behaviors by way of controlling them. And many of the parents have this concern that my child's behavior, the hyperactivity, screaming or hitting, all of this is troubling the daily routine a lot. So that is called challenging behaviors. Challenging behavior is not intentional misbehavior. Please understand. Child is not doing these behaviors intentionally. This is not to be understood as misbehavior. It is communication. So how should we support our children? By learning this communication. See, if I'm speaking in English and you know French, you do not know English, or you know German, or you know some other language, to communicate with each other, you and I, we have to learn each other's language. Then only we'll be able to communicate. If we do not have the common language between us, we'll try to communicate through gestures. We'll try to communicate through some of the references, eyes with hand movements, with lip movements. We'll try to understand each other. That's what exactly the child is trying to do. Child is not able to communicate to you in your language. So child is communicating through behavioral language. So behavior is nothing but a communication. Now, you call it a positive behavior, challenging behavior, whatever it is. This is a communication from child to often express unmet needs, child's needs, sensory overload, emotional overwhelm, and difficulties with communication. Wherever they are not able to communicate to you, they communicate through behavior. So the need is to understand. that communication. So you need to learn your child's behavioral language. And each child may have different behavioral language. In autism spectrum, it is diversity. So each child is unique. So they may have their own behavioral language. We need to understand our child. We need to read their language and come on a same pitch of behavioral communication. So from today, my message is start looking at behavior as communication. What my child is trying to say or communicate by this behavior, what my child is going through emotionally, sensory needs, and that's why a child is doing this communication. So do not look at behavior as something to be fixed upon. Do not look at behavior as a challenge. Do not look at behavior as a concern, but look at behavior as communication. So whenever child is showing you some sort of behavior, which behaviors are those? We'll look at all the further slides. So whenever child is showing us these challenging behaviors, we need to pause instead of reacting. See, there are two different terms, react and respond. So parents need to learn how to respond, then to react. Usually we get into reaction. The moment child has a behavior, we react to that behavior. We immediately try to pull the child, we start giving more instructions, we start shouting at the child, or we try to calm down the child. That all is reaction. Then what is respond? Reaction is immediate reply to an action without a thought process why action is happening. Respond is reply to an action, considering why this action has come and what are the environmental effects of my reaction. For an example, you come, hit me, I go back, hit you. That is action that you have hit me, that is behavior, and I'm hitting you back. In order to stop you hitting me, I'm hitting you back. That is my reaction. But respond is, you are hitting me. I immediately, first of all, make sure that I am in safe position. I go a little backside, little sideways, so that I become safe from your hit. And then consider environment where I am and how should I respond in that environment. And if I hit you back, what is going to be the solution? Why you are hitting me? How to stop you from hitting me? Considering all of this, and then I react. That is respond. So we need to learn how to respond, not how to react. So stop reacting and learn respond. So what we often label as problem behavior is actually a way of communicating stress, confusion, sensory overload, or unmet needs. All of a sudden, usually I have a lot of parents who come to me and say, sir, my child is playing and all of a sudden child starts hitting other children. Or I am feeding the child and all of a sudden child starts hitting me or shows tantrums or behaviors. Nothing happens all of a sudden in this world. Nothing happens. There is definitely some unmet need or sensory overload, some stress or confusion going, and that is visible. That is visible on child's face with child's gestures well in advance. What you need to do is you need to read that. You need to understand that. So the problem here is not the behavior of the child. Problem here is we do not know the language child is speaking. Child is communicating to you through child's behavioral language. We need to learn that language. Once we learn that language, things become very simple. Then we stop getting into the conflict with the child, and there is no behavior that is a problem behavior there. So when we change how to interpret behavior, our response automatically changes. So hence, to change a behavior, change your response to. So interpret, understand the behavior, why it is happening, and how should I react to it? Once we learn this art, immediately you see that all these challenging behavior, common behavioral challenges, which are there on the screen now, which we usually go through as parents on daily basis. Like tantrums in children, if I see tantrums, meltdowns, aggression, hitting, biting, self-hitting, screaming, crying, self-injury, and non-compliance, not following up our instructions, rigidity. All of this is common behavioral challenges which we see in children. And in adults, we see shutdowns, irritability, anxiety-driven avoidance, emotional outbursts, rigidity, and control behaviors. All of these are behavioral communications. They are not problematic behaviors. They are indicators of some unmet need or sensory need or the emotional regulation. So the child is trying to communicate to you. Now, behavior versus emotional dysregulation, if we look into. So most challenging behaviors are rooted in emotional dysregulation. What is emotional dysregulation? It is an internal overload that leads to behavior. So behavioral issue, which is observable action, which you see, and which is behind this observable action, why this action is happening, why this behavior is happening, there it might be an internal emotional overload. So behavior can be learned, but emotional dysregulation needs regulation support. Behavior is often misunderstood as problematic behavior, challenging behavior, um, you know, I would say that misbehavior, all of this. And emotional dysregulation is often ignored. We don't even look at that. The child's emotional needs that needs to be satisfied and regulation support should be provided to the child. So why emotional regulation is difficult in autism? Now, emotional regulation is difficult everywhere, but with neurotypical children, it's slightly easy. Why it is difficult in autism? Because of the neurological differences, difficulty identifying emotions, alexithymia. That is a common concern in people with autism, be it children, be it adults. They do not understand their own emotions. They find it difficult to understand emotions, what's going through. If they are getting angry or if they are getting disturbed, they are not able to express it. They are not able to understand it. Sensory processing challenges, poor interoception, the body awareness, sensory issues, and delayed coping skill. All of this makes emotional regulation difficult in autism. There is the stress cup model. Stress cup model says that every person has stress tolerance level. Each individual has a different stress tolerance level. That's why there are some people who perform really well under stress when you give them targets, when you give them deadlines, and there are some persons they are not able to perform with deadlines, with targets. Many children you might have seen during examination time, even if they have been excellent student in the class, but examination time they find it very difficult to cope up with the stress because under stress conditions they are not able to manage. So the stress cup model is that every person has a different level, a cup. And in autism, this cup fills very faster. Why it fills faster? Because of sensory input, social demands, transitions, and communication efforts. So child is trying to communicate to you, but has language and speech concerns, gesture communication child is following up, but then there are its own difficulties. Child is not able to understand own emotions. That is another stress. Child is having sensory needs. So sensory needs, sensory requirements are not being fulfilled. And social demands. Because of social demands, also child finds stress level goes high. Transitions. Transitions is a difficult phase for a child or an adult in autism. Be it transition from one activity to another activity, be it transition from childhood to adolescent, adolescent to teenage, adulthood, or any transition, be it transition from home to school, school to home. In autism, transition is the most difficult phase. So sensory input, social demands, transitions, communication effort, emotional regulation, all of this together fills this cup of stress very fast. And once the cup is full, overflow. And overflow is what? Behavior. Behavior of concern, behavior, hyperactive behavior, or challenging behavior, whatever name you want to give. So what we need to look into that this cup should not fill fast. The moment cup is there, like little cup is half, cup is 1/4, we need to empty it. Regularly keep on emptying the cup. Once cup does not full, meltdown and shutdown will not happen. I hope you are all are following it. So we need to keep on emptying this cup. Now, how do we empty this cup? By providing support to our children. Triggers versus functions of behavior. So there are triggers for the behavior, and each behavior has a function. That's how you understand. Now, I have a separate series, a separate two session series, behavioral communication, where I have spoken in detail about trigger, ABC model. These are session 1 and 2, part 1, part 2 on my YouTube channel. You all can go through whenever you have time. So there we are talking about behavior as a communication in detail. So triggers could be noise, light, crowd, transitions, demands, or hunger or fatigue. And each behavior has a function. Now, what is the function? I give a formula EATS. EATS is escape, attention, tangible, or sensory regulation. Just to remember these 4 functions. So all the behaviors, most of the behaviors rather, in children with autism have 4 functions. So you name a behavior, we'll find out a function. And if we fulfill the function well in advance, behavior does not appear. Behavior is automatically settled. So either it is escape or attention or tangible or sensory regulation. Either child is trying to escape. For some case examples, if I see, when I took my child to a shopping mall, there were triggers, noise, lights, crowds. Child started screaming. I took child out of the shopping mall. Behavior is settled. So that is escape. Child screamed for escape. Child wanted to escape from that environment. Transitions. When I am transiting, when I am taking child from home to school, child is under anxiety. Child starts screaming. The moment child sees the school bag, the moment child wakes up in the morning, the moment I try to put on the uniform to the child starts screaming. And I understand that child is not willing to go to school. And I give a break today, a holiday. Child is screaming a lot today. Okay, not to go. Escape. Again, the same function. Likewise, I'm teaching in the classroom. There are 25 children or 20 children I'm teaching to. And child starts screaming. Same screaming behavior, but that is for attention. Child needs my attention. I'm paying attention to other children. Child is requiring my attention. Child is given more attention at home, one-to-one settings, and in the classroom, child feels left alone. Or child is finding the work difficult. Child wants my attention. Screaming. Same behavior of screaming which child was using for escape. Here in the classroom, child is using for attention. I take my child to a shop, grocery store. Child looks at a chocolate. Child wants to buy that candy or chocolate. Child starts screaming. That is, function is tangible. Now the screaming behavior is being used for tangible function. To communicate to me that child has some unmet needs. Child wants this chocolate. Or my child is playing with other child, neighbor's child, and they have a teddy bear. Now child wants to play with that teddy bear. and this child is not giving this to him. Again, my child starts screaming. Function is tangible. Child is communicating that I need this item. So tangible is when I need an item or an activity, I show some behavior that is tangible. Function is tangible. Same time, sensory regulation. Now, an example of sensory regulation. I am taking my child outside in traffic area and there is a motorbike which is going with too much of sound, boom, boom, boom. And my child is auditory hypersensitive. Noise is bothering him. Child puts hands on ears and starts screaming. So what child is trying to do with this? Child is trying to sensory regularize. There are multiple tasks given to the child. There are children who are playing. Child is finding it difficult to cope up with them in the playtime. There is so much of attention, coordination required. Child is not able to do that coordination. Child starts screaming. Again, the screaming is being used to sensorily regularize child. So the same behavior, I've given you so many examples, the same behavior can be used for different functions at different times. But each behavior has a function. So the homework for you all is to list down 10 behavior instances, 10 behaviors, and try to find out the function behind those behaviors. You will start understanding your child. I often suggest to all the parents, you should make a diary of behavioral communication to understand, to learn about child's behavior. The very first day when a parent walks into my clinic and they want to work on child's behavior, I ask them to create a diary of behaviors. And every day they need to write down what are the behavior of concerns my child has exhibited today, what were the reasons, ABC formulas we'll be discussing further, and what were the functions. So we write down A, B, C and relate it with functions. So what is ABC? A is antecedent, B is behavior, C is consequence. What happened before the behavior? What was observed during the behavior? And what happened after the behavior? Purpose is to understand behavior, why behavior occurs, not to punish the child. So how we do it in behavioral diary is antecedent. Like for an example, you take any of these examples which I have just told you. I took my child to a shopping mall and child, because of noise, lights or crowd there, started screaming. I took the child out and the behavior got settled. Function we have seen, escape. But what is ABC there? Antecedent is what happened before the behavior. Because there are many behaviors which are dependent on antecedent. Child was playing with other children at home. I mean, neighborhood, say in a park, ground. I pulled my child. No, I am going for shopping. You should come along with me. Child is not happy with this transition. And then I took the child to a shopping mall where noise, crowd, lights are there, which my child is not very comfortable with. Child started screaming. So antecedent in this situation is transition, because I was doing an activity which I was involved into. I was very happy with that activity, and sensory overload together, both of it. So the transition from playing in the playground with other children, which I was enjoying, to going to a shopping mall, and cherry on the cake is the sensory overload, noise, crowd, and lights there. I started exhibiting screaming, hitting, all kind of behaviors. So antecedent in this situation is transition as well as the sensory overload. Often we miss writing transition as the antecedent. We miss looking into what was happening before the behavior. We just look into what is the situation currently, and we just connect it Connect the behavior with the current situation. So current situation is child is in the shopping mall. I understand there is sensory overload. That is the current situation. But to add on, there is a transition behind. So transition plus sensory overload is the real antecedent. Then comes behavior. In behavior, we immediately start reacting. So we do not have to react. As parents, I would say accept your children. We expect others, neighbors, other people around us, the society to accept our children. And the problem is we ourselves do not accept them. With due respect to all parents, I have seen many of these cases. The moment child start exhibiting some behavior, you start controlling because you look around, you look at other people. Oh, other people are looking at me, and you start feeling ashamed. You start controlling your child. You pull your child away from the situation. Why? That means you are not ready to accept your child. And how do you expect the society to accept him or her? So do not get panic. Keep your stress levels under control. Relax. Do not feel social stigma. It's okay to have a child with autism. You're blessed to have a child with autism. So let other people look at you. Let them laugh. Let them shout. Let them do whatever they want. Look at your child. Observe your child. Try to understand what is bothering, what is the antecedent, and support your child during behavior. Do not give, because cup is full. Please understand the cup model I have told you just now. Cup is already full and you give more instructions. Do not cry. If you cry, mama will not bring you again here. I will not get you chocolate, or I'll take you home. I'll lock you at home. All of this works as more triggers and behavior becomes more aggressive. And you also get panic, your stress cup also goes up. So what we are doing here is, instead of emptying our child's cup, we are filling our own cup and adding on in child's cup also. So what we need to do here is observe the behavior, relax. First you relax and let the child also relax. Calm down. Try to change the environment for the child. Because if there is any sensory load in the environment, if there are triggers in the environment, the moment you change the environment, child becomes settled. And then what happened after the behavior? That is also very important. What did child achieve by doing that behavior? Because many of the times, child is doing behavior not because of the antecedent, not because of transition or because of the sensory overload, but to achieve something. That is consequence. How did the behavior settle? The moment child started screaming, you got him the chocolate. Now here, child learns the art of, I will not say blackmailing, because blackmailing is when you purposely do it, but art of communicating to you for his or her needs. Child asked for the candy from you. I want this candy. By gesture or by communicating through speech. Child asked that candy. You didn't get that candy. You didn't hear it. You ignored it. Again, child asked for in a louder voice. You ignored it. Third time, child started screaming, and you immediately bought the candy and gave it to the child. Now, child learns, okay, so whenever I want something and if I'm not getting it, I need to scream, and I get it. Now, screaming becomes communication for child. Whenever child wants something from you, child needs to scream, and child gets it. So how do you react to a behavior? That is also very, very important, because child's communication, child's behavior gets altered with your reaction. How do you respond to a behavior? So antecedent and consequence are the two very important parts by which you can understand a behavior and alter a behavior. You don't have to work on behavior to change behavior. Behavior is just communication. You work on antecedent, you work on consequence, you try to understand the function of a behavior automatically gets settled. So ABC model's purpose is to understand why behavior occurs and not to punish the child. Prevention is better than correction. So predictable routines, visual schedules, clear expectations, choice making, sensory regulation breaks. All of this you need to add in your child or adults, whosoever autism person's schedule. All of this is important. Key messages: most behaviors can be prevented, not managed. So well in advance, if you have predictable routines, visual schedules, clear expectations, choice making, sensory regulations. Now, there are a couple of theories which children with autism or adults with autism do not understand. They do not relate. Emotions, they find it difficult to understand their own emotions. Body awareness, sensory proprioception is missing in them. Same time, the stress levels, they do not understand. Same time, theory of mind concept is missing. What is theory of mind concept? That my feelings, my emotions are different than others. Each individual has different feelings, different emotions. Often, children or adults with autism find it difficult to understand. They feel if I'm happy, the entire world is happy. If I'm sad, everyone is sad. That's why they behave the way they do. Other children, they hit other child cries. They don't understand empathy. They don't understand pain that other child has this is going through pain. So they laugh because theory of mind concept. They don't relate with other people's emotions. That is another part which is missing. And then the time loop. What is going to happen next? When this will end? That's why predictable routines is important. Because they get stuck in loop. What is being stuck in loop? What I mean by that? For an example, we have started this webinar at 8 p.m. India time. If I do not tell you when this webinar will end, how long will I continue speaking? How long do you have to listen? Is this going to be ever-ending process? So it's going to continue whole night, whole day. You will feel stressed. But when you know, okay, 8 o'clock we are starting, 30, 40 minutes, Dr. Alok will speak, then I'll get my chance to ask my questions. Another 15, 20 minutes, we'll have questions. By 9, 9:30, we'll end this. And after that, what I'm going to do, I'm going to have my dinner after that. I am going to go out for dinner, or I'm going to go out for shopping, or whatever. You have plans, you have predictable things. What is going to happen next? Now, children and adult with autism do not have this concept of this prediction. So you need to give that in advance. You need to tell them when it is going to end and what is going to happen next. And that's where the major challenge is. The moment you put them for something that they do not like it, they do not enjoy it, say for studies, for some activities they do not enjoy, which are difficult for them, or going to the school, or taking them out for some other work, they feel that this is never ending. So if you leave them in the school, they feel they have to be in the school for rest of their life. How would you feel if you are in that situation? So that is something that is a trigger for many of the behaviors. So predictable routines are very important for them. Visual schedules, clear expectations, what is expected, especially in case of the adults when they are working at employment places, clear expectations. Choice making, give them options and choices. They are deprived of options in life. A child of 3 years, 4 years starts explaining their choices. I want to eat this. I don't want to eat this. I want red color t-shirt. I don't want to wear a t-shirt today. I want to wear a shirt or a coat. I want shoes. I want sandals. My friend has car. I want that car. I want this toy. That is the 3, 4 years, 5 years child starts speaking. Neurotypical cases. But here, the children with autism are struggling with those communication. So give them communication. As parent, I'm seeing my child. When the child wakes up in the morning, if I'm seeing the daily routine, I give instructions, my child follows the instructions. I tell him, okay, go to the washroom. Child goes to the washroom. Okay, brush your teeth. Child brushes his teeth. Okay, take shower. Child takes shower. Okay, wear these clothes. Child wears those clothes. Where are choices? Where are options? So child is not able to communicate his own choices to you. You start giving choices. Instead of just pulling out one t-shirt and putting on to the child, put two t-shirts, three t-shirts in front of him and ask him which one you want to wear. Let the child choose which one he wants to wear. So add on options. If child is asking you for water through gesture, through communication, through speech and language, whatever, give options. You want water in a cup or glass. You want warm water, cold water. You can have water in bowl also. Let them understand the multiple uses of the same thing, generalization concept. Let them understand, let them start making choices, because this will motivate their brain to act faster when you give options. By giving options, you're motivating them to make choices. They are not able to communicate their choices, but when you give options, and you can add on in your daily routine, you don't have to do anything extra, anything special for them. So give them options, and sensory regulation breaks are very, very important, be it for children, be it for adults with autism. So even at workplaces, we need to give them sensory regulation breaks. They're very. So the key message is most behaviors can be prevented, not managed. We don't have to learn to manage a behavior. We don't have to learn to control a behavior. We have to learn to understand the behavior and prevent the behavior. Core principles of behavior management: relationship before compliance. So first of all, build relationship with the child. Regulate, relate, find out the reason. Teach skills, do not punish behaviors. So behaviors are due to some functions, so teach skills to fulfill those functions. If a child is trying to do a behavior for escape, try to find out why. So regulate, relate, and reason why child is trying to escape from this activity. Mathematics workshop worksheet, whenever I give to the child starts crying. And when I stop mathematics and give English or any other subject, child is happy with that. So why child is having concerns with mathematics worksheet? Child is finding it difficult. So make it simple. Teach skills. Make it easy. Difficulty level you need to decrease. So child has, and do more practice. So child has confidence on that, and then take it to next level. So do not punish the behaviors. Consistency across environments. Whatever we are teaching at the clinic should be followed at home, at school. Whatever we are teaching at school should be followed at school, home and clinic. So vice versa. So it is like generalization of the skills. Whatever we are teaching in behavior, that should be consistent. It shouldn't be that mother is responding to a behavior differently and father is responding to a behavior differently. It happens. Most of the houses, it happens. Grandmother is pampering the child and responding differently, and mother is responding differently. So we all need to come at one pace. That's why I always advocate, when it comes to autism, I always advocate parents, professionals, teachers at one common ground. All of them should be at one common platform. And respect neurodiversity. Some behaviors are choice driven. Respect them as long as they are not bothering you. Not that everything we need to change, not that everything we need to correct. Some behaviors are taken positively, sorry, not positively, but taken as accepted behaviors. So it is neurodiversity. I have my own behavior pattern. You may have your own behavior pattern. When it comes to a family, everybody has their own behavior patterns and we accept them. That's how we live together. That's how we are united as a family. So why not to accept our child's behaviors? Not that every behavior is matter of concern, every behavior needs to be changed, every behavior needs to be managed and worked upon. All right, with this, I would like to end my talk here today, and I'll share this PPT also in the group so you all can go through. I have some handouts also for this. Tomorrow, I'll be sharing those handouts which you can read. I'm open to the questions if you have any.
Uh, Dr. Alok, I want to ask one.
Sure, ma'am.
Asma here. Mm.
Yeah.
Actually, this one, I want more parents to join this JKP Foundation. I want to know how to actually connect them to you. Especially today's workshop, actually, the session was actually very nice. I really was like missing those people, if they would have attended, it would be very useful for them. Can you tell
Okay.
me how to actually bring them into this? Because I can't share the workshop details to them, but how to actually connect them to you?
Ma'am, we have our WhatsApp group. I think you are added there, right? So
Yeah,
I
I'm
will
there.
share. So we can share the invite of that WhatsApp group to all the parents, whomsoever you want,
Okay,
and
okay,
they can join the WhatsApp group. And then we will keep on sharing
okay,
information of our webinars, whatever is happening, and
okay,
they
okay,
can join these classes.
okay. Actually, today it was very useful. I was actually every minute I was thinking about them only.
Okay, thank you so much. Thank you very much.
Thank you,
And
thank you. I
I
will do it.
upload these videos on my YouTube channel as well. Post the
Okay, your
session.
YouTube channel is?
So it is I will share it in the group. I mean
Yeah.
WhatsApp group.
Okay,
I'll
okay,
share the link. Okay, so it
okay,
is
okay, okay,
Aurora Georgian. So
okay,
I'll share the link. So you can share that
okay,
YouTube channel link also to them. But
okay, okay, okay.
it's better they
I
join
I
with
will. Yeah,
us
no, no.
in the
I will
group.
join. I'll make them join so
Yeah,
that they will be
because
benefited.
they can ask their queries. Questions can be
Yeah, yeah.
asked.
Sure, 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 sure.
Yeah.
Yeah.
Sure,
Thank you.
ma'am.
Thank you
Thank
so
you.
much.
Thank you very much. Okay. Any questions? Anybody else?
Uh, Doctor, I have a question. Um, this is I have a student in the school. Um, uh, Starting from home is a challenge for the child. Once he
Mm-hmm.
comes to school, going back home is a challenge. So he either screams, he says, "I will not go home," or while starting from home, he'll say, I don't want to go to school. So this is how his behavior is. So how do we handle this child?
Sudha ma'am, if I don't tell you on which topic I am doing webinar, if you do not know me also, so if there is a random person who comes and says, this is a webinar, there is a webinar at 8 o'clock in the evening and you should join, will you be motivated to join? If
No,
they put a stick on your head and say, no, you have to join this webinar, what will you do? You will still
I'll
join
retaliate.
with half-heartedly. You do not know what is going to happen, when it is going to start, when it is going to end, who is going to conduct, what is the credentials of that person, why should I join? That is what is happening with this child. So this child
And
does not know what is going to happen in the school. Why? See the time loop which I was telling you about in the session just now.
yes,
So the
yes.
child is probably not understanding the concept and child is stuck in the time loop. So child does not know what is going to happen there. Why should I go there? There is no excitement child has. And when it will end, will I come back home or not? Imagine from the child's angle. I'm feeling very excited to share this. I mean, the child is anxious and child feels you are throwing away the child at the school and child is going to be forever in the school. Now child has come to the school. Initial time was difficult. Child is kind of settled. Now child have is happy with the environment. Child is enjoying it. Again, you are pulling back the child from school to home. So again, child is crying.
Okay.
So we need to have predictability, predictable
And
schedule,
one more,
visual
doctor.
schedule to the child. Just one moment. So we need to have predictability. We need to give visual schedule to the child. We need to have motivators in the other environment where I want to transit. So what is
Okay,
the motivation? I go back home. Mama is waiting for me. I will get my ice cream. So that is my
okay,
motivation to go home. So keep one motivation ready. So in the morning itself or one day before itself, show the predictable schedule to the child and have motivation in both the environments, in the
okay,
school, at home. So when you reach school, so tomorrow morning we are going to the school, take the child name. Say child name is Anant. So tomorrow morning, Anant is going to get ready in uniform. Anant will look very beautiful, very handsome. Anant will go to the school. In school, child will enjoy. You will play or you will sing. Teacher is going to sing for you or you are going to dance. So we'll have dance in the school. And then After school, you will again come back home. Mama will prepare a cake, bake a cake for you, or mama will have an ice cream for you. So once you come back home, so create the whole story into visual cards, show the visual cards to the child, and keep those cards the numbering one, number two, number three with the child in the child's pocket. So child can look at it in the school. Okay, what is going to happen next? One is over, two is over, three is over, fourth is go back home and I have an ice cream. So child will enjoy transition. Okay, yeah,
Okay.
please. Sorry to cut short. Yeah, please.
One more thing, what happens? He comes, but he refrains from going to his class. He's happy sitting in one of the classrooms in the ground floor. He picks up a storybook and he reads, and he doesn't want to go to the class. That is one
So we
more
need
big
to
challenge.
so we need to compare both the environments. What are the triggers in the environment? What are bothering you? Why
The
what he
classroom.
likes in this class and what he is not getting in that class? It could be light also. It could be
Okay.
noise levels also. It could be other children also. Maybe there is one child who has hit him badly previously, and this child is scared of that child, does not want to go in that class.
Go to the
It could be
class.
the class teacher also. Maybe the child here in this classroom is left free, whatever he wants to do, but in that classroom, child is given instructions to follow. So child does not want to go to that classroom. Child wants to be free here. So one by one, a detailed analysis is very important. Comparison of both environments, both classroom environments. Maybe child has to go on the first floor and child has difficulty in climbing. Child does not want to climb, or child is on tiptoe walking, toe walking. So because of toe walking, child finds it difficult to climb, and that's why child wants to be in this class. Could be any reason.
Right.
So you need to
Right.
do the analysis of both classrooms.
Analysis.
In case
Okay.
if you find it difficult, create analysis, create the environment of both classrooms on paper, write down and share it with me, and we can have discussions on that. We can find a
Okay.
reason. Definitely there is a reason in environment. Okay.
Okay.
Yeah.
Thank you.
Environment
Thank you, doctor.
comprises of two things, remember. In fact, three. People in the environment, physical space in the environment, and materials we use in the environment. All three
Okay.
needs to be considered. So not only the
Okay.
physical thing, not only the people, even the material. This classroom may have chairs with cushion or benches with cushion, and that may not have. So that could also be one trigger. So you need to do a comparison of both environments. You will find a solution for sure, ma'am. Yeah.
Thank you. Thank you, doctor.
Thank you. Yes, there is a question in the chat box. Let me see that. Shreya says, thank you. Good to see you back. Yes, thank you so much. Thank you. I am actually going through a chronic problem and a long treatment is going on. I was on oral chemo, and because of that, there were lots of ups and downs in my life. But now I'm settled. So I'm happy. I'm happy to be with you all back. Yes, we are not able to follow the schedule. It's been long, but I'm very happy to be back. Okay, Ashwini, Mauritius, Logan from Mauritius. Welcome, welcome all. Jashina from Mauritius. Thank you for joining. Vanisha, thank you. How do we initiate? Shreya is asking a question. How do we initiate BT to toddlers who are full of energy and less sitting tolerance? Shreya, there are some prerequisites before initiating any therapy. So prerequisites are normal hand and eye coordination, eye contact, sitting tolerance, attention span, and we need to work on prerequisites first. And these are not though these are the areas of majorly physiotherapist or an occupational therapist, physical therapist, but even a speech and language pathologist work on it, even a behavior therapist work on it. So together, parents can work on it. Together, all of us need to work on prerequisites of therapies before even starting a therapy. So if a child is full of energy, but less sitting tolerance, we need to do some physical activities with the child and try to increase the sitting tolerance, try to within the activities like swinging. Swinging, child's energy will also be consumed and sitting tolerance will increase. So do the therapies while doing those physical activities. To the toddlers, start with that, work on prerequisites first. And when you attain a certain level of prerequisites, then you start your therapies. Yes, Shreya, you're with me? You can unmute and speak if you have further questions. Okay. Sure. Sir, let me know about pinching and pulling collar habit in special children. What to do? Wow, very good question. Pinching and pulling collar is not a habit. It's a behavior. Now, behavior is for a purpose. Without a purpose, there is no behavior. So what is the purpose? Child is trying to communicate something. In most of the cases, pinching and pulling collar, this such kind of behaviors are for attention purpose. Most of the cases, they are for their attention. So make a list of at least 10, 15, 20 instances when child is pinching, when child is pulling collar. Make a list of those instances. Once you make a list of 20 instances, like say for in continuation for 5 days, 6 days, when you start writing when my child did this pinching, write it in the format of ABC. What was happening before, that is antecedent, what child did, and how did this behavior settle? What is the consequence? What did child achieve by doing this behavior? Then relate it with the function. 90% of the time, my assumption is, because as per my experience, you'll find it function as attention. So child is trying to gain your attention by this function. So that is how we need to work on it. So do not consider this as habit. This is a behavior and we need to work it ABC related with function. Yes. Kolal, if you have further questions, you can discuss, you can unmute. Yes, somebody just raised the hand. You can unmute and speak. You don't have to raise the hand, just unmute and speak in my sessions. Okay. Vashni. Yes, Cyrus. I can see IMG Cyrus tab.
Yeah, it's Dorothy from Africa. A child with both autism and ODD with both traits.
Your voice is barely audible. Can you be a bit loud, please?
Okay. How do you handle a child with both traits of autism and ODD? The child is autistic and defiant at the same time.
You mean your voice is not very clear still? You mean autism and OCD, you are saying?
Okay, it's autism and ODD, oppositional defiant disorder.
Okay. See, I would not be able to give you clear strategies in just like this. You need to send me you can put it in the group also. You need to send me the complete case history. What is the child's age? What are the prime concerns? If you give me those case histories, I can give you these suggestions, what can work on. But I need a detailed case and case history. Okay. So you are there already in the WhatsApp group?
Yeah, it's Dorothy. Sorry, I'm using a different device today.
Dorothy. Okay. Yes. Okay. I can see your name here. Okay. So Dorothy, you can just send me the case history in the group itself so that others will also learn from it. The entire case and present concerns, make the whole history and present concerns. And then send it in the group. I'll give you the suggestions.
Okay. Thank you.
Okay, so coming back to the chat here, Vashni, I'm seeing you for the first time here, I guess. Have you been here before in these sessions? I'm from Skating Club and working on inclusion. Today we welcome a special kid and would like to know from you how to proceed. Vashni, are you there? If you can please unmute. I want to welcome you to these sessions, and you have again you have welcomed a special kid on a skating club. I appreciate that. I appreciate that you're working on inclusion. You need to give me the basics of that case, like the child. What are the prime concerns with the child? And on basis of that, how to support the child into skating, I can give you some strategies. But I need to understand about the case first. Just by saying that he's a special kid, and I need to give you suggestions, it will not relate. So if you can put it up in the WhatsApp group later, the whole case, the age of the child, what are the prime concerns, what is the diagnosis, all of this, just write down. I don't need reports. Just write down in a paragraph, at least 8, 10, 20 lines about the child. and then I can give you my suggestions for sure. Shreya says, thank you, doctor. How do we know that child is closing ears genuinely or showing an escaping behavior when there is no such sounds or triggers in the environment? There are sounds and triggers in the environment which we usually ignore. Okay, right now we are sitting here in this session. Some of you may have a dog barking outside your house. Some of you may have fan sound. Now, when I concentrate, I can hear fan sound. But when I don't concentrate, when I'm talking to you and don't use this word fan sound or AC sound, I don't look at that sound. Because how our brain processes information, please understand the concept, sensory integration concept. Our brain, our sensory system keeps on taking sensory input. Our ears, eyes, nose, we keep on smelling all the time. This sensory sen this senses keep on working and integrate. But we filter out whatever is relevant at what time, we just listen to that. So currently, since you're sitting in this webinar, relevant is we are talking to each other, you are listening to me. So your focus, your attention is here. You tend to ignore so many sounds. There is a doorbell which is ringing, you ignore. Fan is making sound, noise, you ignore. Pressure cooker whistle is there in the kitchen, somebody is cooking in the kitchen, you ignore. But later on, you go back and you ask your mother or you ask your family member, what were you cooking? So many whistles were coming. Who had come at home? So there are so many sounds in the environment, so many noises in the environment rather, which we tend to ignore. We become very immune to it and we focus. But children with autism, they are not able to ignore because they may have hypersensitivity towards specific frequencies. So some children are auditory hypersensitive towards only mixer grinder sound or only sound from a motorbike, but they are okay with other sounds. Some children are hypersensitive only towards the clapping sound. I've seen such children. Just if you clap, they are disturbed. Otherwise, TV sound and everything is perfectly fine with them. So different frequencies, they may be hypersensitive towards too. So child is closing ears genuinely showing escaping behavior. I would say escaping behavior, or it could be the sensory behavior because of sensory integration. For sensory regulation also, we close our ears. Why do we do it? Please understand. When I want to process some information, when I want time to give to my brain, when I want my brain needs time to integrate some information, I want to close my inputs. Because if there is regular information coming in my ears, regular information coming in my eyes, regular information coming through my nose, and brain is processing. Now, brain has sensory processing disorder. 96% children have sensory processing difficulties in autism. 96% means almost all. So if my brain has sensory processing disorder and same time delay and same time more information is coming, what will I do? I will close my input so that brain gets time to process what I've received and then I'll again open mine. Many of the times you see neurotypical people who do not fall in the category of autism spectrum disorder also, closing their sensory input. When you ask a question, they close their eyes, they think and reply. When there are many people who, researchers, I would say, who they put their earplugs in their ears and then they study, they do research because they want to get deeply involved. They cut off their auditory input and they can focus more. There are many people like this. So one thing is child may be hypersensitive towards the sound, that noise that you are not even realizing as environmental sound, but it is there. Or the other thing is child is on SPDs, sensory processing delays. And for catching up with that sensory processing, which he has left, child brain needs time and child is closing ears, closing eyes, and closing that sensory input, either of it. So you need to examine, you need to observe child more. Again, write down ABC, when it happens, try to find out the connections, you will get your answer. Mary, hi, my son is verbal now, but off lately he has started asking one question at least 10 to 15 times. I give answer to him almost 10 to 15 times as per his question. How do I limit this habit? Again, it is not a habit, Mary. Or get this habit in place by limiting him to ask these specific questions only for 2 to 3 times. Mary, the solution lies in visual cards. When child is asking you a question, give the answer, explain him, but same time give a visual card or write. If child has started reading it, write it down or give a visual card. Child can keep it in the pocket and child can see it again and again. What child is trying to do? Why child is asking this question again and again? Tell me that. First, try to understand the reason. Why is child asking a question again and again from you?
So basically, what happens is that, let's say, for example, now he has to go to swimming on Friday. So from Sunday only, he'll start asking that he wants to go swimming. So it's like, he keeps saying that I want to go swimming, I want to go swimming, I want to go swimming, Mama, I want to go swimming. So then again, I have to give him the answer. The swimming is on Friday. So then he keeps quiet. Then again, after like 5 minutes, he asks the same question, like, Mama swimming. Then I have to say it is on Friday. Now, for example, now we have his physiotherapist coming at home on Sunday. So then he keeps asking me, he calls physiotherapist, he calls her Didi. So he keeps asking me, Mama, Didi, then I say Didi will come on Sunday. So he will keep quiet for that time. And then again, after like 5 minutes, he will ask the same question. So, like this, he asks me the same question for 10 to 15 times. And then I have to answer it for 10 to 15 times.
So, Mary, I believe that I am failed to deliver today's lecture because I have already answered your question in the lecture today. But I am failed in delivering it correctly. Now I'm trying to relate it once again for you.
Yes, sir.
See, the child needs predictions. What is going to happen next, or when it is something is going to happen, and child needs confirmations from you again and again. Okay,
Correct.
so predictable routine will help the child. Take the help of visual card behind your door at child's eye level. Put a big paper. I mean a
Okay.
chart. Okay.
Okay.
Whenever child is asking a question, write that question and write the answer there. So
Okay.
child will remind himself again and again. Okay, when are we going for swimming? Please go and look
Okay.
at the please go and look at the chart. Whatever question is
Yes.
asking, write down that question and answer. So let
Makes
child
sense. Okay.
develop the habit of going and reading there. So
Reading.
this
Okay.
anxiety, is it going to
Yeah.
happen when we are going to? So predictability part is missing in child's routine. Add on
Okay.
with the visual card. With the
Yes, sir.
development, because I know your child is growing well. I know the
Yes, sir.
entire case. So with the development,
Yes.
automatically you will see that this habit or this behavior, which you write as habit,
Yes.
will reduce.
Okay,
Because
sir.
that anxiety, child is going through this anxiety.
Yes.
It's going to happen. It's going to happen or not. And child
Okay.
wants confirmation from you. So instead of seeking
Yes.
confirmation from you, you are giving confirmation from a diary or from a chart which child can have a look at.
Very nice.
So
Thank you, sir. Thank you so much
dependency,
for this option.
dependency
I'll do
level
this.
are trying to decrease. Child is dependent
Yes.
on you for this. Now, if
Yes, sir.
child has a diary where all the questions are already answered, or if child has
Yes.
a chart where child can have a look at and look at the answers, child dependency on you decreases.
Okay, sir. Thank you, sir.
And
Thank you so much.
with the
This will help.
development, you will see that this concern will go off. Don't worry.
Yes, sir.
Okay.
This I actually didn't have this kind of thought before. Thank you so much, sir. Now I'll do this for him. I'll write it on a chart. This
Yeah.
is a very good practice that you've given me. Thank you, sir.
So please try. And if you have further challenges, do not hesitate to connect with me.
Sure, sure. Thank you, sir.
So, Vashni, thank you, sir. I will try to ask the parents to join the group also. One of the major concerns is also how to prepare the other skaters to accept the child. Yes, that is one of the major concern. We find the same concerns in the school also. And Sudha ma'am is here. She has been into teaching for long. She is a senior professional, so she can also share her inputs. So it's not only about preparing the child or preparing ourselves. It's about preparing the environment also. So environment also needs to be child friendly. When there is a special child, again, environment, as I said, comprises of three things: people, physical space, and materials. So in skating also, you need to see child's concerns, align it with other people in the environment, that is majorly other children or other instructors or admins people, staff people, support staff people. Also, the physical space you need to align with this child needs, and the materials you are going to use, you need to align with child needs. You need to work on all three. Okay. So other children, other peer group and their parents, not only other children. If the skating group is of children, so other parents might not be comfortable their children doing skating with a special child. That is also a concern. So you need to look at each thing separately, create awareness, make them aware about the challenges this child is facing and how they can support, how they can contribute. And the best part, when you want alignment from people, I've realized in my life, practically I've used it. When I need help, I seek help. I don't hesitate to share my concerns with people and people come forward and help me. But if I hide it, if I try to hide and try to overcome it, kind of by masking, there is no help and people acceptance is not there. So to create acceptance, what we need to do is we need to advocate for it. We need to be open about it. So do not hesitate to first you make a list of challenges this child is facing that might be a hurdle in skating and how others can contribute to it. Have a discussion with them, open discussion. Let them know this child is a special child. These are the concerns. Not necessarily in presence of this child, but in absence of this child also you can do it. So what are the concerns and how they can contribute? Just by saying concerns also, you will not get the solution. You need to speak about, create awareness and then define the roles. So how you can contribute, how you can support. That is also very important. So make a list of challenges of my child and what are the conditions and how other children can contribute to it. This awareness session will help you to seek support from other children. Try doing it. If you need any help, connect with me. I'm open to help you out. Shreya, doctor, how to intervene laughing behavior during sessions and what all could be reason for child goes on laughing? Majorly, laughing behavior is for two reasons. One is for attention during the sessions. If child needs change in the escape, not attention. So if it is one-to-one session, child wants to escape from your activity and child starts laughing. That is the major reason. Number one. And number two, we find it for the sensory regulation. There is too much you are giving to the child in the session. So when there is too much, child wants time for processing. Child can close ears, child can start laughing, child may start repeating, child may close eyes, or child may start jumping. All of these behaviors during one-to-one sessions, if you're giving, you see just to regulate themselves because they don't want any more input. So they are purposely doing one output that closes all inputs. So in general, for our senses, this happens. Once you start humming, you start making a sound. What happens is your other senses go a little down. That's what exactly we do in meditation. We chant some mantras, we make some sound. But why we do that? By doing it, we are closing all the sensory input. We are bringing our attention back to some topic where we want it to be. So child is doing same thing by making some sound, be it laughing sound, be it screaming sound, be it some other sound, humming sound. That is why children keep on making some sounds or keep on singing also in autism. You see, once one song they have heard, they keep on singing the same rhyme, same song again and again and again and again to close down the extra input to their brain for momentary close down so that their brain gets time to process the information which was given before. So this laughing is usually during 1 to 7 sessions. Specifically, I'm telling you, as you have asked for during sessions. So this laughing usually is related to their SPDs, sensory processing delays. So you are giving too much of information which they want to coordinate with, and they do laughing. Or for escape. It's a long session, my sitting span is less, I start laughing, immediately I distract you. So how we can change this behavior? By changing how we respond, that is consequence, or by looking at the antecedent. What is happening before? So difficulty level you can decrease, pace you can slow down. You give a break to the child after every 15 minutes for 2 minutes of jumping break or some activity break. So this behavior you can reduce by doing these activities. Sangeeta, there is a 12-year-old student in our school who shows challenges in behavior and social interaction. She feels uneasy and struggles when meeting new people. We teach social stories, we teach sit. She knows she has to sit quietly, but sometimes she starts crying and anxiety to start quietly. She understands positive behavior and social rules, but often behaves in negative ways. She knows the difference between good and bad, yet tends to touch or do bad actions despite understanding. Now, Sangeeta, major challenge here is that we assume that she knows the difference between good and bad. When asked good and bad through visual cards or through asking just by this is good, this is bad, she is replying. But practical uses of good and bad, whether she understands or not. So assumption is something which we usually do with children. So each part has multiple things. I know good and bad in the school, but same things, same good and bad do I know at home? So environment, I know good and bad with teacher, but good and bad in front of visitors, do I know that? Do I relate it with their? So people with autism, they relate activities, skills with their environment. Environment is with material, with people, and with physical space. That's why the major complaint from parents usually is at clinic in front of you, in front of therapist, child does everything, but at home, child does not do it because the environment is changed. Or in front of father, child does it, in front of mother, child does not do it. People changed. Or when you change material also. With a spoon, child is able to eat properly, but bigger spoon, but smaller spoon, child does not eat. Because the material is changed. Child is trained on this material, child is happy with this material. The other material uses, child does not. So the major part is whatever you have taught the skills, good and bad or other skills, you have not done the generalization part of. So teach the same skills with different people in different environments, and you see the response of the child. So challenges in behavior and social interaction, you need to find out what are the difficulties child has for social interactions, provide those skills so that social interaction part improves and so that child is happy meeting new people. Why child is not happy meeting new people, please understand, because I have some difficulties meeting new people. I'm not able to connect with new people. Why do I shy away from people? Because I have some difficulties. Now, what are those difficulties? That I need to work. And give me exposure. Exposure and experience makes behavior settled. So exposure of meeting new people. Every day I'm meeting new people. Then slowly I become immune to that anxiety which I have meeting new people. So it may take a little time. You have to go a little slow, but give exposure to the child. List out the challenges child is facing, which are becoming a hurdle in child's day-to-day routine in meeting new people. Work on that. And do not assume that child knows this. Yes, you have taught to the child has understood this, but practical application of that needs to be worked on. When you ask, child replies, or when you show, child points out well, that is learning. Child has learned it. But practical uses, that needs to be taught. Okay, Sangeeta?
Yes, sir. But we are working in a so that she does not have any behavior. But whenever we are not available at that time, she shows challenging behavior. How to take her in environment to generalize?
See, one thing is you need to train parents also on it. All the people who are there in child's environment, make a list of child environment. So parents, the teachers, or if child is going for some therapies, then therapist, all of you should be aligned. All of you should know how we are handling one behavior. Everyone should handle the same behavior in the same way. Now, if you are handling it differently and parents are handling it differently at home, child will have concerns with the behavior.
Okay.
Okay. So we need to
Okay.
first make a list of environment, physical spaces, which all physical spaces child moves around. Child goes to the playground on a daily basis in routine. Child goes at home and child is at school. So these are three different physical, or if therapy is then clinic. So these are three or four physical spaces. What are the materials used in physical spaces? That should be similar. So in skill training, whatever I'm teaching here, in behavior, whatever I'm teaching here, should be followed and practiced at home in the same manner. So you need to train parents also on that how what strategies I'm using and how they should react. You don't have to spend a lot of time. Just make a list, make copies of 3, 4 pages, write down everything, give it to parent, have 15 minutes call on parent, they understand. So they should also respond in the same. Then you will see the same output. Otherwise, the output differs. Okay.
Okay. Thank you, sir. Thank you, doctor.
Okay, Asma. Asma says, I have one question. Yes, Asma, you can unmute and speak your question. You can ask.
Yes, yes, sir. Sir, actually, you said you can over, when the cup is half filled, that's like, when I keep, when it's too much, only when the cup is filled too much, they let out their emotion. I want to know how do you, let out that when the for this one you said, no, half emotions are filled itself when you keep emptying the. I want to know about that. How do you empty that?
How do we empty that? By giving them sensory breaks, sensory regulation, emotional regulation. We
Okay,
understand
what
their
actually
stress
you are
level
supposed to talk to them
by
and find out what is.
no, no, we don't have to
Mm,
talk to them. We need to find out the
mm,
triggers, change, make
mm.
corrections in the environment so that triggers are
Okay,
not
okay,
there. Okay.
okay,
Depending upon
okay,
each child's abilities, depending upon their communication level, you can speak with them
mm,
also, but depending
okay,
upon their communication and understanding level as per autism. And
okay, okay,
sensory breaks you can provide them. You can give them, sensory corners. We have one regulation zone. Okay, let me explain this concept. I had kept it for the next session, but since you have asked the
okay,
question, I advocate every clinic, every school, and every home to have safe zone for the child. And safe zone, you don't need bigger space. You may have a smaller corner of your house, or you may have just 20 square feet of space, 30 square feet of space dedicated to your child, with where you should have cushions on the walls. You should have foam sheets, which are easily available, or you can just put thermocol or foam on the walls till the child's hand level. Like child is 2 feet and with 3 feet, and with hand child is 5 feet. So till 5 feet of the height, you have thermocol or you have foam sheets on the walls of that corner. Okay. Below on the ground, you have just mattress, no furniture, just the mattress, a good fluffy mattress that can be there. Some cushions, some teddy bears, or some soft toys there. A heavy blanket, weighted blanket can also be there. Now, as soon as you see a child is going through some stress, or you see the cup is half, as you said, you give 10 minutes time for safe zone to child. Okay, go and play in safe zone. Their child goes, child throws away those pillows, child hits those walls, child enjoys those, throws, jumps on that, child does it and regulates himself, comes back. So in routine, if you set up a routine that after every 2 hours, 3 hours, child is getting 10 minutes, 15 minutes on a random basis, don't make it at 9 o'clock and 9:15. No. Whenever you feel that child is with the child's behavior, with the child expressions, the child is getting little agitated, you need to just give time to the child there. Child will enjoy this activity, enjoy this safe corner, and you will see with practice You don't have to tell the child to go there. Child will automatically start going there. Child will put that blanket on himself, weighted blanket, heavy blanket. Child will play with those toys. Child will throw them, and child will regulate himself and come back. Child will do some jumping and come back. So that is self-regulation. So self-regulation will start when you start giving. Initially, you need to be on instruction-based regulation, and then automatically child start doing self-regulation because child feels comfortable after doing those activities. In clinics, we may have trampoline also added to that. We may have some swings also added to that. In schools, we may have such kind of activity in a playground, a safe corner in the playground, demarkable, but you need to have clear fencing, clear demarcation of the safe zone. And that will help a lot in sensory regulation to the children. Okay.
Thank you, doctor. One more thing I wanted to ask is, when
Mhm.
they are they are hypersensitive to sound. They cannot tolerate loud sound in the class. So that time, how can we, the child wants to run away from that place because he's sensitive to the sound. That time,
Hmm.
what can we do? Every time we have to let him come out, or
So we
what?
have earplugs. Usually, when you travel, see some airlines give you the earplugs. So we
Yeah,
have
yeah.
similar earplugs that can be given to the child. We have specially
Okay,
designed noise cancellation headphones. So noise
okay,
cancellation
okay.
headphones you can purchase and you can give to the child. So whenever child is facing more sound, child will, instead of closing ears, instead of running away from the
Mm,
environment, child puts on
mm.
that earplugs or headphones and child feels comfortable. That is one area.
Okay,
Second area
okay.
is we need to slowly increase immunity towards hypersensitivity, auditory hypersensitivity. How do we slowly increase this immunity? Uh, we expose the child to favorable activities and give the background sound. So first, find out which are the frequencies or which are the sounds which are that are disturbing to the child. Is it all loud sounds or specific loud sounds that are disturbing to the child? Okay. Now engage child in therapy mode, not in the classroom mode, but in therapy mode. Engage child in an activity which is favorable by child, which child enjoys the most, and give that sound in the background on a lower pitch. Say, for an example, my child is disturbed with motor sounds, the motorbikes, the grinder mixtures, the cooler, air coolers, all those sounds. My child is wherever motor movement, drill machine. So my child is disturbed with. What I do is I record that different sounds. I involve child in favorable activities at a good time when child is in happy mood, good arousals, and child is enjoying the activity. I ask one of my family member or house help to just play that sound, but little lesser volume, slow volume. So the intensity of that sound has to be less. Play that sound in background for few moments and look at child's reaction. Child is engaged in the activity, child is least bothered. Slowly increase. It's a process. Don't do it on the same day. Every day, slowly, slowly, slowly you increase. After a month, after 2 months, you will see child becomes automatically immune to those sounds. We have practically done it with in Spandan. We have done it with a 16-year-old child who was like child name is Fabian, and till the age of 16 years, he was totally dependent on for food and everything, even for ADLs. And child used to close ears, non-verbal, even for the fan sound. Child was not comfortable even with the sound of the fan. So, and child needs fan all the time, even if it is cold outside. Child needs fan. So he used to keep the fan on and he used to keep ears like this. Now, when child is engaged 24/7 like this, except sleeping time, all the time child is engaged like this, then how child would learn anything? Their hands are engaged. So we did the similar things. He was fond of watching TV. So we played TV and in background we gave such sounds, inputs, and we have seen now within first 6 months, the habit was the behavior was completely gone within 6 months. Now the behavior is still there, but only on very extreme sounds. But in regular, things are very, very different. Now this child is making on plate, eating food, doing his own ADLs, taking bath, everything child is doing. This has been a journey of 2 years with him now. but great improvement. So similarly, with all children, you can try this and this strategy helps. But
Yeah,
remember,
thank you
you
so much.
engage them in enjoyable activity, their favorable activity. You
Okay.
engage them so that they're engaged there. Still that input goes there. Brain learns to ignore that input.
Actually, I had the same thought that if we can expose to that, but what happens if he starts hitting the other children? He starts
That's
pinching
why I
because he's
said
not able to tolerate. Yeah,
I
now
give a
I can
disclaimer.
actually,
I
yeah,
give a
yeah,
disclaimer in therapy settings, not in classroom
yeah.
settings.
Now I'm
And
able
then
to
intensity.
understand how to expose that and slowly get him used to it.
Yes.
Yeah,
So
thank you so
the
much. It is
intensity
actually
of
good.
the volume that needs to be
Yeah,
controlled.
I understood that. Okay. Thank
So
you
you
so
need to
much.
actually, Asma, you need to make a chart. Chart of intensity
Okay,
0 to 10. Okay. Start with
okay,
intensity 0, then 1,
okay,
then 2, then
mm,
3.
okay,
Likewise, you need to increase. How in fan
okay.
regulator we have modes 1, 2, 3,
Yeah,
4, 5.
yeah.
So similarly, you need to increase, not randomly.
Okay,
Do not go on a random
okay,
thing. So you have a scale.
okay.
On that scale, you need to increase
Fine.
and align
Okay.
it
Thank you
with
so much.
child's tolerance level. The moment you see child is not tolerating it,
Uh,
immediately
uh, uh,
stop it, reduce it,
okay.
align it. Child may take
Okay.
10 days to tolerate, go from 1 to level 2. No problem. Let the child
Mm-mm.
take 10 days. Don't be in hurry.
Okay.
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 Because you want
Yeah,
permanent
yeah.
solution of this problem. So permanent
Okay.
solution may take time. It may take 6 months also, but you will get the
Okay
solution
then.
for sure. Okay.
Okay. Yeah, thank you so much.
Okay, Sangeeta. We are working on
Done, sir.
a
Already done.
student. Okay, it's already done. Okay.
Yeah.
Some parents react the laughing behavior by scolding them. Yes, that's where Kolal Kishore Kakati. Yes, that's where the problem lies. How we react. I told you in the beginning of the session, stop reacting, start responding. Behavior will automatically get settled. So we need to respond to a behavior, not to react. Their cup is already full, cup of stress, that is already full. That's why this overflow is happening. And by scolding them, you are adding on in the cup. So if you made a cup of tea or a milk and cup is full and you keep on pouring, what will happen? The more you pour, the more will spill out. So more you scold, more they will behave. Their behavior will become more intense or more hyper. I just ignore the laughing behavior and make the child regulate. I am doing right thing. Yes, Shreya, you are doing right thing because if the laughing behavior is happening for escape and you are ignoring it, it's fine. But if the laughing behavior is happening for attention and you are ignoring it, laughing behavior will become more intense. It may turn into crying, it may turn into hitting. So, first, your strategy is right, but first try to relate the behavior with function. What is the function? I've told you 4 functions of a behavior: eats, escape, attention, tangible, that is communication, and sensory. So make a list of the multiple instances when the child is doing the behavior and connect it with the functions. If you find it the function and same behavior may be used multiple times for different functions. So if you find the function is escape, you can ignore it. Or why child wants to escape, that also you need to look into. Is it a longer duration child has been into this particular activity, or is it very difficult for the child, or child needs some break? So start giving breaks. Start adjust with the difficulty levels. So ignorance is okay, but with ignorance, you need to make the changes in antecedents. Okay. Same time, if the behavior is for attention, then you need to give pre-attention. So ignoring is okay depending upon the function. And with ignoring, you also need to adjust because consistent ignoring, need is not fulfilled, child may get into intense behavior. Instead of laughing, child may get into hitting or screaming or some other behavior. So that you need to take care of. Is it possible to have topic on speech webinar, please? Yes, we will have topic on speech. I think last we did was communication and communication development in the children, language and communication development. We have already done that. I'll upload, I think the recording has not been uploaded. So I'll upload that recording on the YouTube channel. Maybe tomorrow I'll ask the team to do that. You can see that. But specifically on speech development, specifically on the development of the speech, I may ask the speech and language pathologist and we will conduct a session. Sure, once we complete this series. If you are aware, the series is of 12 sessions. I have put it up in the group. I'll put it again tomorrow. So we have completed 6 today. So there are 6 more sessions that we will complete, and then we may have a speech session dedicated to speech development activities, which parents can follow at home or the therapist can also follow. Specifically for speech development activities, we'll have a session for sure. Okay, any more questions? Anyone? All right. So if there are no more questions, I would request any one of you to summarize what we have learned today. Any of you, anybody can take initiative and please summarize. I can see a new face. I can see Meluleki Mafofu. Would you please summarize how the session was and what we have learned today? Just give me a moment. There is somebody at door. Yeah, I'm sorry. I'm sorry. I'm back now. So yes, Meluleki. I think you need to unmute. I have been seeing you. You have been very attentive with your facial expressions. I've been seeing that you are following up. I'm requesting you to unmute. I have sent you the message. Maybe you're finding it difficult to unmute. Okay, not a problem. Next Sunday, we can connect again in the next session. I understand that it is. There is one more question which has popped up. Shreya is asking how important it is to have a shadow teacher. First, we need to understand why do we need to have a shadow teacher? What is the role of shadow teacher? Nowadays, this has become a trend. Child is with autism, schools say that have a shadow teacher, and parents also feel, many of the parents I have seen, not blaming them with due respect, they feel that, oh, it's a status symbol to have a shadow teacher for my child. But why do we need a shadow teacher? That we need to understand. What is the role of the shadow teacher? Children with autism, they have communication difficulties. So shadow teacher, other children, they come back home, they tell what has happened in the school, what are the things happening, what we are learning, and parent help them in homework. But child with autism find it difficult to communicate the same. Now, especially in India, the government has made it mandatory to have resource room in the schools, the infrastructure for inclusive education, and they're promoting a lot as per IEP or this education policy, NEP, National Education Policy 2020. Right to admission is there for autism, so schools cannot deny the admission. Now, schools have made it a very casual process. Every autism session, every child with autism, they just say, okay, appoint a shadow teacher. It's a very costly affair. A shadow teacher in bigger cities may cost you 25,000 to 30,000 every month. In smaller town, B town, tier 2 town, it may cost you 15 to 18,000 a month. And there is no structured program on shadow teacher from a specific from the UGC. So there are many people who are just doing small one short of webinars courses on shadow teaching, and then they are calling themselves a shadow teacher. So we need to be very specific whether the shadow teacher is really required, what is the role of shadow teacher, and what the shadow teacher whom we are appointing has those fulfilling those qualities. So shadow teachers' prime role is to be a bridge between the school and parent. Second role is behavior management of the child. so that child is settled in the classroom and child is learning. And third role is to be assistant as an assistant teacher. So simplify whatever is being taught in the classroom, simplify that and teach to the child in the style child learns. Whereas we are finding shadow teachers playing role of just merely a caretaker. A caretaker in the school is named as shadow teacher. Shadow teacher is not a caretaker. Shadow teacher is an expert on behavior management so that child is regulated, child is settled, child is aligned with the classroom, aligned with peer group, is a academic assistant. So she knows the basics of special education also so that she simplifies the concepts in the way my child can learn and teach to the child, and a communicator between the school and parent. These three qualities should be there. So it is important to appoint a shadow teacher wherever the need is, not for every child. Depending upon child's constraints, it is important. Vashni says, I have issue with my mic. Just want to thank you for enriching session. Looking forward for the next session, next one. Wish all parents and teachers a lot of courage. Thank you. Thank you, Vashni, for your motivating words. Thank you so much. So anybody else now, since Vashni has issues with the mic, Malulike is also have issues, Nilambri or Kishore or Asma, any one of you, Neeraj is also here. So Neeraj, any one of you would like to summarize today's session? Shreya also has mic issues, no problem.
So
Sangeeta, you want
I will.
Okay.
I was I'm a little busy, but I was following your lecture. So I will tell you that I actually really enjoyed that how to regulate. Actually, this I'm a special educator in school, so I'm actually having two children like this. So for me, it was very difficult to understand how to actually control the children, like when they're having this behavioral issue, especially when the sensory overload and all that. So the cup filled no with the sensory over the emotional, that actually was really helpful for me to understand, okay, how we actually have to help the child. Okay, especially the second thing when you gave the example, how you have to discuss with them and slowly get into that. I think that I will try, I will use it, and maybe in the next this one session, inshallah, I will discuss whether how it was working, whether it was working, or am I doing some mistake on that.
Okay, sure,
But
Asma, you are free to
I really enjoyed the session, and I always wait for your sessions. Because you give very good tips on how to actually. It is all practically, you give some management tips. So actually, it really helped me. After a long time, actually, I'm attending your session. I was
No,
always part
after
of
a
a
long time, I'm
JKP.
conducting the session.
Maybe, but I thought maybe I have not attended the
No,
sessions in between.
no. I am
Yeah.
conducting the webinar session after a long time. So thank you
Okay,
very
okay.
much, Asma. Thank you
Thank you
all the
so much.
participants. You don't have to wait for your questions to be answered in the session. Webinar group,
Okay,
WhatsApp
okay.
group has been created. You may put up your
Yes,
concerns,
yes.
questions in the group, your queries. I will answer there also.
Mm.
You don't have to
Okay,
wait for
okay,
the
okay.
okay.
Okay, I will actually try this for some time. Maybe next session I will personally ask you so that we can have a discussion.
Sure. Most
Yeah,
welcome.
thank you.
All right. Thank you, everyone. Thank you for giving time, especially on Sunday evening. I know this is the busiest time for everyone. You're taking time and joining the session. So thank you so much. Wish you all the best. We'll connect back again on next Sunday. Thank you.
Thank you, Dr.
Thank
Alok. Thank you so
you.
much.